All right, so let's begin with our keynote speaker, who's Dr. Jeannie Park. And just as a brief introduction, she received her MD from the University of Alabama at Birmingham, go UAB. And then she started moving west. She moved to Washington University School of Medicine for her internal medicine residency, and then moved further west to USC for her nephrology fellowship. And then she also did some postdoctoral research training at USC and as well UCLA. She has an MS in our Master of Science in Biomedical and Clinical Investigation from the Keck School of Medicine at USC. And then, having run out of space, she moved back east. So she started over again. She's moved to Emory University. And her research focuses on human physiology. And it's involving the regulation of the sympathetic nervous system in patients who have high risk for cardiovascular events. She is going to deliver a little bit of a different topic today, Jeannie, right? Transitioning from fellow to faculty, a junior faculty perspective. So Jeannie, I would invite you to come forward and talk with me.
So thank you for that introduction, and thank you for all the organizers for giving me this great opportunity to be here today. I am really honored to be here. So this morning I'm going to share some thoughts about transitioning from fellow to faculty, from a junior faculty perspective, as someone who maybe did this relatively recently. So I'll start by giving you a list of some of the references that I thought was pretty helpful, and also to let you know that I didn't just completely make up everything that I'm going to tell you this morning. So it's an amalgamation, I guess, of the most important points I thought from reading these articles and talking to my colleagues, and also my own perspective from my experience as well. So I will start by giving you some thoughts about choosing an academic research career, how to make that choice, and maybe how to start going down that pathway. Some tips for what you might want to consider doing during your fellowship to prepare for this research career. A few thoughts about finding the right position for your first faculty job, and then some tips for success as a junior faculty member, which I put success in quotes because I think success is going to be defined differently for everyone. So success meaning to find the career that is most satisfying for you, that you enjoy getting up and going to work every single day. So what is a physician scientist? And I think for the PhD scientists in the room, you have more of an early start. For those of us who are physicians, I feel that we're kind of a little late in the game in terms of starting our research career. So a physician scientist is a practicing clinician who spends the bulk of his or her time doing research. And physician scientists engage in all types of research. So we can do basic translational clinical research, including clinical trials, and also population research, such as epidemiology and outcome studies. And physician scientists are also involved in clinical activities and teaching, as well as service and administration. So the unique feature, I would say, about being a physician scientist is that you have the ability to identify novel and clinically relevant questions at the bedside, and then have the knowledge and tools to study those questions in the laboratory, and then apply them back to the bedside. So do you have what it takes to go down this pathway? What are the qualities that are necessary to be a physician scientist? So I did not make this up. I got this list of traits that some people have deemed necessary in order to become a scientist. And I kind of laughed when I looked at this because every single person in this room has these intrinsic characteristics, because otherwise you would not have made it this far. So you need to be self-motivated, hardworking, be a problem solver, good at multitasking, have perseverance, dedication, etc. If you did not have these traits, you probably would not be sitting in this room right now. So what's not on this list, by the way, is to be a brilliant scientist, which I certainly am not, and I'm not saying that just to be self-deprecating, but there are skills that you can acquire and learn as you go down this pathway. But these are intrinsic characteristics that you need to have in order to be successful in this career. So besides that, so we all have these, so what you really need is a desire to go down this pathway. And that is to make a commitment to make it your goal. And if you make a commitment, then you can apply all of these wonderful attributes that you have in order to work towards this very rewarding career. So what do you do as an academic research scientist? So again, the majority of your time is spent in research, and so that involves, of course, coming up with new research ideas, writing grants, collecting data, and writing papers. But there are a lot of other components to this as well that I have come to discover going down this pathway, and that is running a research lab or a group, interacting with the scientific community and attending and presenting at national meetings, serving on scientific committees and reviewing papers and grants. So there is a lot of variety and a lot of different types of activities that are involved in running a research program. And again, physician scientists are also involved in clinical activities. So for example, I have a couple of outpatient clinics per week, and I also attend on the consult service, inpatient consult service. And we're also involved in teaching as well. So why choose this pathway? So these are some advantages that I have identified talking with my colleagues and also from my own perspective. So this career in academic research, so as a physician scientist, is great because there's so much variety. Every day can be different. I'm not doing the exact same thing every day. And I can say this because my husband is in private practice, but he does the same thing every day. And he sees patients all day, every day. For me, I love seeing patients, but I would like to have a lot of breadth and variety to my career. And so being a physician scientist lends itself well for that. It also gives you an opportunity to exercise other parts of your brain that you might not necessarily do so much in other careers as a physician. So using your creativity, there's constant learning and advancement. So I read an article about how the majority of physicians, unfortunately, have a lot of job dissatisfaction. And one of the reasons for that is because we're all very goal-oriented and are used to transitioning from one phase to another. So you go from medical school to internship, or to graduate school, residency, to fellowship, and then you become an attending physician. And a lot of people are left with, well, what now? I've achieved what I set out to achieve. Now what do I do? So as a physician scientist, there's constant opportunity for learning, constant opportunity to evolve and to advance and to become, to expand your expertise and to grow in your career. One thing that I've really appreciated in this career pathway is that I'm surrounded by excellence. So my colleagues are fantastic clinicians, they're fantastic educators, and fantastic scientists. And I get to be a part of that group, which is really inspiring and motivating. The other advantage I would say is flexibility and autonomy. So as opposed to maybe doing research in the industry setting, I get to come up with my own ideas and I get to figure out how I would like to approach those questions. And I have flexibility in terms of what I do and when I do it. So I want to do patient care, I can decide what kind of patient care I do, what kind of teaching I do, and of course what kind of research I do. And to me, one very deeply satisfying aspect of this pathway is that I have this feeling that I'm contributing at multiple levels. So I'm contributing by taking care of patients, I'm contributing to the education of the next generation of nephrologists, and also contributing to our field and contributing to scientific knowledge. So there are some disadvantages as well. So a physician scientist and anyone in academia will get paid less than in private practice. But there are ways to help mitigate that. So I highly recommend the NIH loan repayment program, which I benefited from for the first few years of my faculty position, in which the NIH will pay back a substantial portion of your medical school loans if you're engaged in research. There's a lot of troubleshooting involved in this, going down this pathway, as well as a lot of rejection. So rejection and failure is part of the process. It's part of success. So you cannot have success without having rejection or failure. But I think as goal-oriented physicians and graduate students, we're not used to failure at all. So it can take some getting used to, and it can be very discouraging. But if you keep in mind that that's just part of your way to success, then it's absolutely possible to power through it. And then some people might actually think of this as a disadvantage. So a career as a physician scientist involves constant learning and constant evolving and constantly adapting, which I would actually say is one of the benefits of this career. So the bottom line is, if you have the desire to pursue this rewarding career, then you should go for it, and you should make it your goal. So you should not, I would say, have the attitude that, well, I'll just try it, and then if it works out, great. If it doesn't, then I won't do research anymore. Because if you have that attitude, then it's not going to work out. So apply the same kind of commitment that you did to get through residency and to get through fellowship, and you will be successful. So here are some tips that I would suggest that you might want to consider doing during your fellowship to prepare for this transition to your first faculty position. So first is to choose your scientific niche. So if you are a PhD scientist, then again, you're way ahead of the game, and you've probably chosen your research field early on in graduate school. But as physicians, and this was my case too, that I discovered my research area during my fellowship. And so when you're doing so, you should be, I would advise, thinking long term. So instead of thinking, well, I'll work on this during my fellowship, but I really want to work on this, and just switching gears during your faculty years, it's really best to set yourself up for a long-term research area, a scientific niche as a fellow. But at the same time, you have to be practical and flexible. So if you, for example, really want to study lupus nephritis, but there's no one at your institution doing that, then you're going to need to be somewhat flexible in terms of your area of research, and then to stick with it. So I thought I would just tell you how I chose my scientific niche, or maybe how it chose me. So like I said, one of the prerequisites for going down this pathway is not necessarily to be a brilliant scientist, which I am not. So I always considered myself very left-brained. So I actually was a music major when I entered Rice University. I played the piano, and I was interested in English literature and creative writing. And I struggled with my science classes. It did not come naturally to me. So this is what I think I'm naturally good at. But at the same time, I really wanted to be a doctor, and I was interested in research as well. And so I returned to my home state of Alabama, and I went to UAB for medical school. And while there, I really fell in love with physiology during my first year of medical school, and particularly renal physiology. So water, electrolyte, acid base. which is not my scientific niche right now, by the way, but I think many of us are drawn to the field because of our love of physiology and water electrolyte acid base. So then after medical school, I went to Washington University for my residency, and I was part of the clinical scientist training and research program there. And I did very clinical, kind of patient-oriented, database type of research in acute kidney injury. I have to say that those 3 years at Washington University were probably the best years of my life. Well, I shouldn't say that. Don't tell my husband I said that. But those were really wonderful years, and I had everything planned out because, of course, we're all planners, right? So I had accepted a position as chief resident, and I was going to be the editor of the Washington Manual, which the chief resident gets to do. And so I thought, okay, this is my pathway to doing academic medicine. I need to go this route. Well, it turns out that instead I got married. It's my husband, and he's a GI, and at that time there was no match, and so he had signed on to go to LA County in California, all the way across the country from my family, and he kind of botched my plans, my perfect plan to stay at WashU for the rest of my life. And it was actually a very painful decision for me because it was the first time that I had to make a decision not based on my own interest in career, because everything up to that point I did basically just for myself. And so in some ways I thought, okay, this is the end. I'm not going to be able to make it. But I'm sharing this with you because as long as you have the desire, things are not going to go exactly maybe the way that you plan, but it will work out. There are many different ways of achieving a very good outcome. So I ended up going to LA County to do my nephrology fellowship, which is a very clinically oriented program. There was not much research going on there at all. But I did have the opportunity to get some research training over at UCLA. And so I went to UCLA and to work with Holly Middlecoff, who is a cardiologist. And she was studying neural control of the circulation in heart failure. And so I went to her lab and I learned some of the human physiology techniques that she was using, and I applied them to kidney disease patients, which no one else had done before. And so now my scientific niche is in the neural control of the circulation in kidney disease patients and the regulation of the sympathetic nervous system. And I perform both basic mechanistic studies in humans and clinical trials and intervention studies. So I'll just share with you a little bit about why I love what I do. For me, it feels a lot like what I was trained to do. So I see patients and I do procedures on them and I collect data from them. I do a history and physical on them. So here are some of the techniques that we use in our lab. So this is a sympathetic nerve recording along with continuous hemodynamic monitoring. And again, going back to my love of physiology, this field is great because it gives you instant gratification. So this is just an example of the types of studies that we can observe. So here are some controls and some patients with end-stage renal disease. And you can see that sympathetic activity goes up right in front of your eyes during apnea and also during the Valsalva maneuver, which we all know happens, but it's still really exciting to see it in a human in real time. So some other things, so one of the advantages I feel of being a physician in research is that we can do some more invasive things, some medical things perhaps, and if you're a PhD, it's great to collaborate with physicians, and for me, it's great to collaborate with PhDs as well because there's a lot of rigorous kind of scientific thought and background that I'm not as familiar with that my colleagues, my PhD colleagues can help me with. So some examples are, we can apply lower body negative pressure, which decreases venous return to the heart and can measure autonomic and hemodynamic adjustments based on that. We also do some pharmacologic manipulation of blood pressure by giving intravenous nitroprusside and phenylephrine. And we do some pharmacologic studies as well, looking at vascular alpha-1 adrenergic receptor sensitivity. So we can do mathematical models and look at the sensitivity of blood vessels to catecholamines in chronic kidney disease and controls. So what I really like is that, again, it gives me instant gratification, and there's a method for real ability to find real measurable differences that we can look for between patient groups. And I also do some clinical trials as well, which also feels very much like what I'm trained to do as a physician. So we see patients and we can randomize them to medication. So in this case, we randomize to BH4, which increases nitric oxide bioavailability compared to placebo, and observe that there's an improvement or a reduction in sympathetic activity in chronic kidney disease. So again, I think it's important to think long term. So pick an area that you're really passionate about, that you think that you can do for the long term, and start it in your fellowship if you can. But also be practical and be flexible and stick with it. So the second tip that I have is to seek mentorship. So a lot of people place a lot of emphasis on the importance of the mentor, that it will make or break your career. And I think having a mentor is important, but the most important thing really is to be an active mentee. Okay, so it's not that the mentor is going to provide everything that you need and carve this pathway, and all you have to do is walk down it and be a receptacle for everything that your mentor is going to give you. And it's actually very hard to find one person that's going to meet all of your needs for mentorship. So you need to really understand what your training needs are and what deficits you have, basically, and seek out the mentors to help you achieve your training goals. And so for me, I have multiple mentors. I want to give a shout out to my division director, Jeff Sands, and it's a great advantage to consider your division director to be one of your mentors. But I have scientific mentors. I have those that help me with work-life balance, those that give me advice about grants and papers, those that give me career development advice. And so you can and should have multiple mentors. And your mentors can be outside of your division or department, outside of your institution. But the most important thing about a mentor, and that really defines a mentor, is that a mentor should have an interest in seeing you succeed and offer you honest advice with your best interests in mind. Okay? So someone who does not have these traits would not necessarily be a good mentor. So my third bit of advice is to write a grant as a fellow. So writing a grant during your fellowship will tremendously increase your chance of establishing a research career. So that's not just my opinion. That's actually been shown to be true. The number one predictor of being able to establish an independent research career is getting an F32 or individual postdoctoral research fellowship, more so than getting a K award. So you should do it. Even if you're on an institutional training grant and don't necessarily need to do it, I think it's very important to do it, because the first time you do anything, there's a big learning curve. It can be arduous, and so you don't want the first time that you write a grant to be during your faculty position. And so it's a really great exercise to write a grant as a fellow and try to make a concerted effort to write the first draft on your own. So why? Because it gives you the opportunity to gain all of these skills. So to write the grant, formulate a plan, and also come up with alternative interpretations and future directions, which is not only important for the grant, but also important for you, because you want to already be thinking about the next step. So your postdoctoral fellowship work should be a springboard for what you'll do for your Career Development Award or your K Award application. And so writing a grant is the best thing that you can do to prepare for that. There's also a lot of logistical things involved in submitting a grant and organizing a grant as a PI, so soliciting letters of support and things like that. It also gives you the opportunity to communicate with your program officer at the NIH, which is something that you'll be doing throughout the rest of your career. So it's great practice to start doing that as a fellow. You'll also get a summary statement, which is really very helpful and will help you write the next grant, and is a pathway to getting your K award. So I pulled up my F-32 application because somebody asked me for it, and I was very reluctant to release it because I kind of cringed when I read it, but still, it was the best thing I think that I could have done. And I did it because there were no resources where I was. There was no institutional training grant, and I really wanted to pursue this path, and so to do it, I had to write the grant. But you are all in very good institutions with lots of support, but I still recommend going through this process. So here are some different fellowship grants that you can apply for. The F-32 offers the longest duration and probably the most institutional or project support. So my fourth tip is to try to practice being independent as a fellow. So I'm saying all of these things because I'm kind of reflecting on my own experience as a fellow, which again just happened out of necessity, not because I necessarily planned things to be this way. But so you should write a grant, as I said, write a paper, set up your lab. So again, you may already be in a very well-established lab, but if there's some opportunity for you to bring a new technique in or set up a new method, then I highly recommend trying to do that on your own and trying to troubleshoot that on your own. Become technically proficient. So if you have to call your mentor every time you do a procedure, then you're not completely technically proficient yet. So it's best to really not rush it and take the time to make sure that you are proficient before you make the transition to a faculty position. So just a few thoughts about finding the right position. I would say that the main thing that you need to make sure of is that the goals of the division and the department align with your goals to become a physician scientist. So if the job that you're considering is really looking for a clinician educator or someone to fill in all of the gaps in the attending schedule, but they're also going to give you some time for research to do on the side, that is not the right position for you, because you need your boss and your department should be behind you in terms of your goals to go down this academic research pathway. So it would also be nice to be in a research institution with potential mentors. Talk to peers and your advisors and your mentors about the process. And I have to say I was pretty naive about it. When I think back, I think it's best to try to understand and communicate your needs. So figure out what you need in order to be successful and ask for it up front. And think about your K grant as you're interviewing. So when you interview for your jobs, you should be already thinking, well, okay, this is what I'm doing in my fellowship. How can I expand it here into a K grant application? So early on, it's important to invest your time into establishing your research career. You can always increase your clinical time later, but it's difficult to do the reverse. So for me, this was also a little bit of a difficult decision as well, because I was very interested in making sure that I maintain my clinical skills. I wanted to be able to do everything. I wanted to continue to be able to put in lines and do biopsies and all of it. But again, it's really important to establish the research first, especially as physicians when we're getting a late start, because the clinical training, you've had many years of clinical training, and it's very possible to continue being an excellent clinician. So I would advise that it's helpful to relate your clinical work and teaching to your research endeavors. So for me, I take care of chronic kidney disease because I study chronic kidney disease patients. I do lectures on cardiovascular risk in chronic kidney disease and hypertension. And so it really is a way to develop expertise both as a clinician and as a researcher. And write a K-grant application within your first year, which will be much easier for you to do because you've already gone through the process of writing a fellowship grant. So the K-grant should be a logical extension of your postdoctoral fellowship work, but with the new direction and new training opportunities that can be tailored to the resources that are available at your institution. And I would say that you should take advantage of all the funding opportunities for junior faculty members. So also as a physician, again, maybe starting a little later in the game, to not rush going from junior to senior necessarily as well. So, you know, if you can get as many of these awards as possible and spend as much time in a junior position until you feel very ready to be independent, that's going to be, I think, a better recipe for long-term success. And so don't give up. Troubleshooting is part of the process. So I'll just tell you a little bit about my trajectory. So for my F32, I studied sympathetic regulation during exercise and end-stage renal disease. And then I got my dream job at Emory. And at Emory, there's a lot of focus on vascular biology, and so I threw vascular in there. So I looked at how the sympathetic nervous system affects vascular function in chronic kidney disease. And then my R1 is now there's the word neurovascular. So how does neurovascular responses then translate into changes in hemodynamics in chronic kidney disease? And it's okay to go where the research takes you as well, although you know, everyone told me you need to be very focused, and so I tried to be. But at the same time, I'm a VA physician, and half of my patients had comorbid post-traumatic stress disorder. And so now I am a nephrologist studying PTSD. So I'm just going to give you a few examples of the trouble that I've run into and how to overcome them. So any problem really can have a solution, and it may not be the way that you anticipated things might go, but it will work out. So when I first got to Emory and I was going to set up my lab, which I had already had the experience of setting up a lab as a fellow, so I felt like I kind of knew what I needed to do. I found out that the nerve traffic analyzer, which is the main equipment that I use to do microneurography, is no longer being manufactured by the University of Iowa. So I could have easily quit at this point because this is the main technique that I use. So this is called troubleshooting. So I begged my mentors to give me theirs, and of course everyone's hoarding them right now because there are only about 20 of these devices in the country that are being used. I looked to see if there are other manufacturers, which there aren't. I asked them for the blueprints so I could go to Georgia Tech and ask them to make this for me, and they wouldn't give it to me. So finally we worked out that the University of Iowa contracted with an outside vendor, and they agreed to make the machine for me for about 3 times as much as it used to cost. And then they didn't have anyone to troubleshoot the machine. And so it was mailed back to me about 5 times, back and forth. So I would test it, didn't work, send it back. Test it, didn't work, send it back. By the 5th time, I realized, okay, maybe the machine is working, but then it was just not working at Emory or at the VA. And so there was a lot of electrical interference that was not making it possible for me to do the study. So I took the machine outside and I started doing measurements outside to see if that was the case. So this is all the troubleshooting process. But once I got it to work, it's still working well to this day. So there's no problem that cannot be somehow creatively overcome. So here's another example. So sodium nitroprusside is a medication that we use a lot in our studies to manipulate blood pressure, and I don't know if you remember the controversy with Valiant Pharmaceuticals some years back, but they were the company that was buying up these old drugs and then doing price gouging basically. And so I was previously paying $21 per vial for this old medication that we're all familiar with. And then Valiant, one day we tried to order more drug, and then I got this bill for like $50,000. And so the vial had increased, one dose went up to $1,800. And so now what? Do I stop doing these experiments? So I changed the protocol completely. So there are several things that we ended up doing. We started stacking the patients, so the vial is good for 24 hours. So we try to use one vial for 4 or 5 patients if we could. Looked into alternative vasodilator techniques and other ways of making the measurements that we needed to make. So it's about $200 a vial now. The CEO got fired, and it's all over the news, but it's still pretty relatively expensive. So these are my kids, and I feel bad putting them under the troubleshooting part of my talk, but a lot of things in your personal life, I've come to find, are not things that we can plan, which can be difficult for us because we're all very goal-oriented and we're planners. And so things don't work out necessarily the way that we plan, but I'm here to tell you that it will be okay. And so during my first year as a faculty member, I was pregnant with twins and was on bed rest for basically 5 months. And then the twins were born 10 weeks early, and it was a complicated delivery. It took me a very long time to recover, and I was busy taking them to multiple doctor's visits for another year. And so needless to say, there was some decreased productivity during this time and a delayed start, along with the fact that I couldn't get the equipment that I needed. So again, it's very easy to become discouraged. There's a pipeline to becoming a physician. You're already trained to do that. You don't have to go through all of this hassle. But believe me, it's worth going through because I have a job now that I am super happy to go to work every single day. I think that a lot of physicians can necessarily say that. So some take-home points are, if you have the desire for this career path, go for it. Be an active mentee. Practice your independence early. Be resourceful and adaptive. The obstacles can be overcome, and enjoy your successes.
We do have a few minutes for questions.
So the question is about persistence. So what made me be persistent despite all of the challenges? I think that we all have persistence. It's difficult to get through medical school. It's difficult to get through residency. And a lot of it, I think, is a mindset. So we have the mindset that we're not going to fail our residency. We're not going to fail our fellowship. And so if you have the attitude that this is the career that you want, then you will apply your persistence to making sure you don't fail. I really think it's about mindset. So if you had the attitude maybe during your intern year, when you're working 80 hours a week, that, well, I'll just try this out, and if I like it, then, great. If I don't like it, then I'll just, go open up a Starbucks or something. Then it's easy to just say, this is not fun. But you apply your persistence because you have the goal that failure is not an option. And so if you have that attitude, I think, with pursuing this career path, then you have proven that you can apply persistence to meet your goals. So again, I think the more you experience it, actually, it gets better. I think it's, again, you cannot have success without having failure. And I think up to this point, all of our type A personalities, we've gotten straight A's, or we've always gotten what we've wanted. And so it's a different feeling to spend all this time on what you think is a brilliant idea, and you stayed up 3 nights in a row and you turn it in, and then someone just completely trashes it. But it's all part of the process. If you don't go through that process, then you can't have the grant that scores in the top 10% and lets you launch your career. So I think that means I need to stop talking.
Just shout.
So I would say that all of you, if you're sitting in the room, you've already made I was not sitting in a room like this when I was a fellow, so you're already way ahead of the game, and that good luck to you. And if I can help in any way, please let me know.
Do you think networking plays a role? For example, if you have someone locally whom you trust who can review your grant, provide you some advice, do you think that's helpful?
Oh yeah, absolutely. Absolutely. It doesn't necessarily have to be someone in your field. It can be someone who just is very experienced, and actually it might even be helpful to have someone who's not in your field review your grants and papers.
It's amazing how you get married to your words, and suddenly someone will tell you, this has no meaning to me. And
Right.
you go, what do you mean?
Right.
I thought I was clear.
Mm-hmm.
Thank you very much.
Thank
It's
you.
very